I've been getting some interesting questions lately about IVF pregnancy rates, such as, I've heard that people never get pregnant on the first try, is that true? Or is the success rate for IVF higher on the second try? Does the uterus need a few practice runs before a pregnancy can happen? Surrogacy for All, I will discuss what the science says about these questions. In order to have a discussion about pregnancy rates, we must first make sure that we are all talking about the same concepts. Let's say 100 couples have gone through an egg retrieval, and each couple has 3 embryos frozen. Those 100 couples then start their frozen embryo transfer preparation. A single embryo is thawed and transferred for each couple. For this example, we will assume that 100% of the embryos survive the thawing process. This isn't always the case, however. During the first embryo transfer attempt, 60 couples become pregnant. That is a pregnancy rate of 60%. This leaves 40 couples who did not become pregnant. Those 40 couples then go through a second embryo transfer, and 24 of the couples become pregnant. For this second attempt, the pregnancy rate is again 60%, no difference. The pregnancy rate in the first and second attempt was the same. IVF doctors will say that the pregnancy per transfer is the same. However, you can also calculate the total number of couples who became pregnant over both attempts. 60 couples became pregnant on the first attempt, and 24 couples became pregnant on the second attempt. The total is 84. IVF doctors will say that the cumulative pregnancy rate over 2 attempts is 84%. This is a very important point. The pregnancy rate on each attempt was the same, 60%, but the cumulative rate over 2 cycles was 84%. People commonly get this confused and mistakenly believe that the pregnancy rate on the second attempt only is 84%, but this is not correct. With that background, what do the numbers look like at some top fertility centers? So far this year, they have performed 310 frozen embryo transfers. 219 of those they performed on patients doing their first, second, or third attempt. 8 days after the embryo transfer, they performed a blood test to look at their HCG level. A patient was diagnosed as pregnant if their HCG was greater than 5 and then increased 2 to 3 days later. Since they know that pregnancy rates decline in older women, they divided the patients into 3 groups. Group 1 were transfers in which they used embryos that were tested for chromosome abnormalities. This is known as PGT. The chance for pregnancy with tested embryos does not differ by age. Once they knew the embryo was normal, older and younger patients have the same chance for pregnancy. Groups 2 and 3 were transfers with untested embryos in younger and older women. Here are the pregnancy rates for tested embryos. As you can see, the pregnancy rates were roughly the same whether it was the first, second, or third attempt. For younger patients with untested embryos, again, there was no difference in the chance for pregnancy through 3 attempts. For older patients, the pregnancy rate was the same through 2 attempts and decreased a bit on the third attempt. So let's go back to those questions that I have been getting. Question 1 was, I've heard that people never get pregnant on the first try. Is that true? Clearly, that is not true. Pregnancy rates on the first attempt are the same as with subsequent attempts. Question 2 was, is the success rate for IVF higher on the second try? We have now shown that this is not the case. Question 3 was, does the uterus need a few practice runs before a pregnancy can happen? Clearly, this is not true either. Let's look at one more question. If couples do a second transfer, it is either because their first attempt failed, meaning they didn't get pregnant or miscarried on the first attempt, or they became pregnant and delivered and are now coming back for a second child. These are 2 very different situations. It brings up another question. Is the chance for pregnancy better if the first attempt resulted in a delivery? Looking at this data, they were not able to show that couples with a previous delivery had a better chance on their next embryo transfer. The bottom line is this. The pregnancy rates with frozen embryo transfers don't change much over 3 attempts. On average, your chances for getting pregnant on your first try are similar to the chance on your second or third try. Begin your journey with Surrogacy for All. At Surrogacy for All, we're here to listen and connect you with the right resources and professionals to help you realize your dreams of parenthood. To schedule an appointment with one of our counselors or affiliated physicians, please call 212-661-7673 or email us at info@surrogacy4all.com. We're here to support you every step of the way.